welcome to our virtual event on treatment options for hair thinning and loss. I'm Stacy with Des Moines Plastic Surgery. We're going to go over some different treatment options that are new to Des Moines Plastic Surgery and Coachlight today. Be sure to stay till the very end. There's a Q&A session, and you'll also be eligible for one of our giveaways. So there's multiple factors that can contribute to hair thinning and loss. Biggest ones are genetic predisposition, as well as environmental factors, including stress, pregnancy, weight loss, and hormonal imbalances. So GetHairMD is a multi-modality treatment system, several different options. A few main options include the FDA-approved red light laser that's done in the office. They also offer a personalized topical prescription that is personalized based on a genetic test. There's also treatment options for home use, including clinically proven at-home vitamins, supplements, and at-home red light therapies as well. PRF involves using your own fibrin to get growth factors and injecting them into the scalp to help stimulate that hair follicle to grow and get out of its dormant phase. Your provider can let you know if you'd be a good candidate for that, and that can be used in conjunction with any of the GetHairMD modalities. Hormonal imbalances can definitely contribute to hair thinning and loss. At Coachlight, we do offer bioidentical hormone replacement therapies. You can discuss with your provider to see if you'd be a candidate for that. That also can be used in conjunction with any of the GetHairMD modalities. The advantage of the treatments that we offer here at Des Moines Plastic Surgery and Coachlight is that we can use them in conjunction with each other and develop a customized plan that's unique to each patient's scenario. Thanks everyone for watching and learning the different treatment options for hair thinning and loss here at Des Moines Plastic Surgery and Coachlight, including our GetHairMD system, BHRT, and PRF treatments. Be sure to stay tuned for our live Q&A and learn more about each modality in detail and be eligible for one of our giveaways.
Hi, everyone. Welcome to our virtual event. I'll let some more people jump in on here. I already see some questions coming in on the feed. My name is Lauren Caleb. I do the marketing for Des Moines Plastic Surgery and Coachlight, and I have our dear Stacy Murphy, Physician's Associate at Des Moines Plastic Surgery, here to help answer questions and help us understand more kind of the hair loss and thinning options here that we have at Des Moines Plastic Surgery and Coachlight. So Stacy, welcome.
Thank you.
Yes. We've done this before, right? So yes, guys, a couple housekeeping items too before we get started with the Q&A and Stacy can answer your questions in more detail. You have to stay till the end to be eligible for our giveaway, which is either a $750 credit towards one of our hair thinning and loss treatments, or you can option for a full face Botox/Dysport treatment, your choice. But we can see if you completed the watching the event. So stay till the end. And then we will try and be done by 12:30 at the latest. I will cut it off at some point and we'll answer questions in the chat if there's still some remaining. So Stacy.
Yeah.
A lot of things. So GetHairMD, because that is our main hair loss, thinning, and treatment multi-modality option. Okay, so can you help us? I already see questions on this. Can you break down some of the options that are included in this scope of GetHairMD?
Yeah, absolutely. So they have a clinical red light laser, which actually is sitting behind us right here.
Yes.
And it is it delivers low light energy at certain nanometer wavelengths to help stimulate the blood supply to the follicle, help the production of ATP, which is helpful to make our follicles healthy, and also block DHT, which is harmful to the follicles.
Okay.
There is an at-home version of this as well for patients or clients that don't live close to our office, because you do have to come in and sit under this in the office here. So there's an at-home version as well that patients can use at home. And then another option is they do have a personalized prescription topical medication, and that is personalized based off of a genetic test that we do here in the office. So it is going to tell you what specific prescriptions you're going to respond best to, and just customize it to you specifically.
Cool. So that was 3 options, and then like there's more too. But let's talk about like the red light in office treatment. How many times are you coming in? Who's a candidate for it? Can you elaborate on that more?
Yeah, pretty much everyone is a candidate for it. If there's a hair follicle there, we can stimulate it with the red light. Now, those patients that are, shiny bald and there's no follicle present, we can't really stimulate anything that's not there. So pretty much everyone is a candidate for the in-office red light laser. It usually entails either a 6-month course or a 12-month course. You would come in twice a week for the first 3 months, and then once a week for the next 3 months. That would be your 6-month course. The 12-month course would be twice a week for the first 3 months, once a week for the next 3 months, and then every other week for the remaining 6 months.
Okay. And then to be clear too, like this is a red light laser, but it's not like laser like hot or anything.
Yes, yep. It is non-invasive. It does not produce heat. It's literally, you'll feel like you're just sitting under a light, but it is stimulating those follicle and the blood supply to the follicle as well.
How long do you sit under it?
You can do 20 minutes or 30 minutes at a time.
Okay. And it doesn't matter, like I can just option. I want to sit
however much time you have in your day for that appointment.
Okay. And so that's an option for like in office. And then you said the at home dual wave energy cap is what it's called, right?
Yes.
Then that would be more, what's the treatment scenario there?
Yep. So that's going to be more for someone who wants to supplement their in-office laser treatments, or someone that doesn't live close here and they can do this at home. It would be meant to be worn for 10 minutes every single day. And it's rechargeable, so you plug it in just like you plug in your cell phone to charge at night.
Yeah, guys can see it online too. It's like, it's just a cap that you put on, but it has red light.
Yep, and you can control it with an app on your phone. So you put it on and you press start on the app and just sit under it for 10 minutes.
Fun. And guys, when we're saying red light too, we're saying like FDA cleared red light therapy. Not red light therapy is very popular.
Yes.
Right.
Yep.
In social media and just for treatments for skin and hair. But it has to be like an actual red light wavelength. Want to be clear on that. And our like modalities are FDA cleared for treating hair loss. Not like if I go on Amazon and buy a red light, it's possible you're just buying a red light bulb.
You're absolutely right. Yeah. You want to make sure you have the right nanometer wavelength, which all the GetHairMD devices do, obviously. They're, like Lauren said, FDA cleared for this.
Yes. Tempting, I know, to go purchase something that has red light in the verbiage on Amazon or TikTok or whatever, but you are, buying a red light bulb. So maybe a placebo effect happens with that. Okay. And then you also, what I think is cool is the prescription, the personalized prescription.
Yes.
Can you tell me more about that?
Yeah, so that's really cool. So it's really interesting. So over-the-counter like options for like putting stuff on your scalp to help your hair grow is basically minoxidil is your option for over-the-counter medication. But interestingly, 38% of the population will not respond to minoxidil because of a certain genome that they have. So this DNA test, we take a swab of the cheek. It literally takes 1 minute, and we send that in, and the lab will analyze it and figure out what prescription topical you will respond best to based off of, your DNA. So it's absolutely customized to each patient. So again, if you're not a responder to like an over-the-counter minoxidil, which is Rogaine, it's just not worth putting on your scalp. So it will formulate a prescription for you personally, and that's just sprayed on there once a day.
Nice. I was fascinated to hear that too when we first picked up GetHairMD, that like a certain segment of the population, you won't even know this unless you get the genetic test. You don't absorb the minoxidil, like you don't metabolize it correctly to even stimulate hair growth. So if you're buying the Rogaine or minoxidil, hers brand, all of them, that's what it is. It's an over-the-counter level of minoxidil, and there's a 40% chance you're not even going to respond to it. And so I'm thinking like, okay, how many times I know people that like have done the over the counter stuff. I'm like, oh, I didn't see a result. Well, there's a 40% chance like you're not even going to see a result. So it's just interesting that, and also want to note too, for like this GetHairMD scenario, we're the only provider in Iowa right now that has that option for any of the GetHairMD modalities, as well as like a customized prescription. So if you're wanting like a physician supervised prescription level treatment, topical, come do a consult just to see if like what you're a candidate for and what Stacey can recommend. So those three things. Another thing that is a great modality and interesting that we picked up with the GetHairMD is people are asking too, is like it's the needleless infusion treatment in office. Tell me more about that.
Yes, so I don't know if you can see it, it's sitting behind us here too.
We're like kind of blurred out.
But it sends, it's an in-office treatment, like Lauren said, takes about 20 minutes, and it sends tiny electrical currents or impulses into the scalp. It is painless though. I've done it on myself and staff members. You can't feel it at all, but basically those electrical currents are opening up the ion water channels of your scalp. We're placing a growth serum on the scalp at the same time. So it's making it so that growth serum can get directly to the follicle, because the follicle lives about 3 to 5 millimeters under the scalp. So if you're just putting things on topically, you're not getting all of that absorption down into the follicle. So it's just a means of delivering the medication directly to the follicle.
Without a needle.
Yeah. So without needle like PRF. So there's no cellular damage. There's no inflammation caused by sticking lots of needles in the scalp, like with PRF treatments.
Yeah. I was interested of like learning about that too, of like how efficient it is. Like it actually like delivers the product way more efficiently. Like some practices will do like microneedling and PRF even on the scalp too. And this needleless infusion is just, again, way more efficient at like delivering that product to the cellular level that it needs to go to. I had another question. It's funny to ask about, like, what is the age range? Like, could you do this as young as 18?
Yep, it's FDA approved for 18 and older.
Okay, for all the modalities.
Correct. Yep.
Nice. Okay, so those were some of the options for GetHairMD. There's also some more like at-home scenario too. I brought a little prop here, which is I have this. This is my Light Smart cap, right? Yes. And it is like another option included in some of our packages for it, but it does have like tell me more.
Yeah.
Like,
so it's
not red light, but
it's made with patented fibers that have this nanotechnology where you wear it outside in the sunlight, so it takes UV light and it basically transmits that UV light into a low level red light, again to try to stimulate the follicle and blood circulation to the follicle. Also obviously protects against UV damage, not only of your scalp but of your face too.
Yes. I like the multitasking scenario. Like, why would you not wear this hat if, like, in theory, it's protecting like your face shade, like you're out on watching baseball or whatever all day, wear the hat, and then it helps with the health of your scalp too. So I thought that was pretty cool, and it's pretty reasonably priced in my opinion too, to have like, again, this is an FDA cleared scenario for them to like claim that it's it has like it converts those wavelengths. I'm not so well spoken on it. But
So it's, again, those patented fibers are what makes it so that converts that UV ray into the red light.
Yes. So. Good stuff. So that's another option. They also have like a shampoo, a conditioner, and a rapid growth serum that you can use at home too. Again, very like reasonably priced. And honestly, like some of those price points for the like at home stuff is less than like designer shampoo and conditioner, which is great. You know, you want like an option that's just going to care for like the current hair too and your scalp health. Cool. All right. So good question. Got more in the chat here. I've heard that BHRT can also contribute to hair loss. Is that true?
So nowadays with more bioidentical hormones, we don't see that as much. I feel like back in the day when they were using more synthetic hormones that weren't bioidentical, yes, you were seeing some hair loss with some BHRT.
Yeah, it's actually kind of the opposite to my understanding. Like it could actually like increase hair growth because you're becoming more balanced. Like it's the imbalance.
Hormonal imbalances can contribute to hair loss. So balancing the hormones is theoretically helping that hair loss too.
Yes. So does this help with alopecia? Any of the treatments?
It can help with certain types of alopecia. Now, if you are talking more like alopecia totalis, where you have that bald, shiny head and there aren't follicles there to stimulate, it's not going to help with that. But if you have just areas of alopecia, it certainly can help with that.
Yes, so potentially. And your provider, Stacy, would determine that in an in-person consultation to see if you're a candidate. So what else do we have? Would this help hair grow after chemo?
Yeah, absolutely.
Yes. There's a lot of like, I was listening to a podcast today, even of a person who was like getting the GetHairMD treatment and talking about how they had chemo. The hair didn't like grow back when they were done with their treatment quite the way they wanted it to, or, you know, it just wasn't the same.
Yeah.
And so this is a good option to do to stimulate the follicle growth again. Heather, I'm already on or in hormone replacement therapy. How is that different than the bioidentical hormone replacement therapy?
Yeah, so I mean, we obviously think it's best to use a bioidentical hormone that your body, you know, just recognizes as one of its own hormones rather than a synthetic hormone. You're just going to get better hormonal balance and less side effects with a bioidentical hormone.
Yep. And yeah, during a consultation, that would be with our nurse practitioner at Coachlight. She can explain that in more detail of why we option for the bioidentical hormone replacement therapy scenario. Do you have anything for preventative hair loss? Or recommend anything to prevent hair loss?
Yeah, so we have been seeing a lot of gentlemen that are, you know, reaching that age where they're starting to notice a little bit of hair thinning. So they want to be more proactive and do things to prevent things rather than coming in here when they do have, you know, a lot of hair thinning or balding. So I think like an at-home red light or in-office red light would be great for preventative measure because it's helping like stimulate your current hair too and make your current hair healthy and thicker, as well as like the personalized prescription topical. I mean, just getting on something and using that as kind of like a maintenance rather than waiting until it's, you know, maybe too late. If you're having a lot of balding, is a good option.
Keep those follicles stimulated, right?
Yeah.
Don't wait till like they're possibly unable to be stimulated again.
They also have a great over-the-counter gummy vitamin. That's just 2 gummy vitamins a day. That would be a good option for just kind of generalized hair health as well.
Nice. Is this like an ongoing treatment? What's the long-term effectiveness?
That's a great question. So once, you know, as I said, with the in-office lasers, that's usually like a 6-month or a 12-month process. Once you get to a spot where you are happy with your hair, I wouldn't recommend just stopping. I would do something to help, you know, maintain that over time, whether that be, you know, one of the over-the-counter shampoos or vitamins that they offer, or doing like an at-home red light every so often rather than like daily. But you want to, you know, nourish what you've got and what you've regrown, and doing some sort of maintenance with that.
Yeah. And it sounds like too that needleless infusion is
a good option.
A more like maintenance mode treatment as well once you like complete like the red light and get kind of the density that you want. How do I find out if I'm a good candidate for this treatment? Great question, Kate. I did not supply that. So yes, how do you find out?
So during a consultation here in the office, we can do a hair analysis where we actually take pictures of the scalp, and you can see the number of active follicles per square centimeter and also the health of the follicle. It's really cool. It like breaks it down into like different color coats. So the healthy follicles are like this dark green color on the analysis, and then yellow is kind of those follicles that are, you know, maybe thinning, a little suffering. They're a little thinner than we'd like them to be. And then those red ones that we see on the analysis are ones that may be kind of on their last leg. Like if the hair gets plucked out or falls out of that follicle, you may not be growing a new hair. So it's good to target that before that happens. But it's a really cool tool to use with this hair analysis to see kind of the health of your hair at baseline. And then we can also use this as a tool to repeat the hair analysis in 6 months after your treatment to make sure, you know, we're seeing increased hair counts and the health of the hair follicle is improved as well.
Yes, we're actually documenting your starting point with a legit hair camera, head camera, and that's been cool to see too, of just seeing the change, the density of hair for people that are getting treatments. So this is an open-ended question, sure, but what option is most effective in your opinion?
From studies that I've seen, I would say the red light and the personalized compounded topical prescription are probably going to be the two most desirable for sure. Yeah.
And the red light in the in-office clinical hair growth laser, that has over a 90% effective rate since they started it like in 2013 or 14. I don't know.
2013.
2013. Yeah. Over 90%. So again, it's like when we do pick up a modality or, you know, treatment, we need to have, it can't be like minoxidil where 40%, it's not going to work for them and they don't even know. So we were excited to finally like bring on board a modality of treatments that includes one that has since for over a decade has over 90% effective rate. For those experiencing pregnancy, peer and hair loss.
Postpartum hair loss.
Oh, postpartum hair loss. Okay. When are you able to start the treatment?
So technically it's not approved for pregnancy, so you would need to wait until after you deliver. But no problems with the red light with like nursing or breastfeeding. Some of the prescription topical, like the personalized prescriptions, there's some prescriptions that you cannot use during like nursing, but the red light you could use right after delivering.
Yes. So Rhonda, in relation to like BHRT or what estrogen therapies are available, we have for our BHRT treatments, it's a pellet therapy. And our provider, Michaela, nurse practitioner at Coachlight, during a consultation would recommend, I'm answering this for you because it's a like more broad-based question. She wanted to know what estrogen therapies are available. So Michaela would like advise on whether you could do some therapies that are not the pellet therapy, or just go with the pellet therapy to adjust your hormones. Does that make sense? Yeah. Okay, good stuff. Yeah. Will the hair grow? Will the hair grow faster if you come into the clinic to do the red light treatment, or versus like the at-home?
Yeah. So the in-office red light treatment, I mean, it is a little bit more potent. So that's why you don't have to do it as often. So it's just that twice a week for the first 3 months and then once a week for the next 3 months, as opposed to the at-home red light is meant to be worn for 10 minutes every single day. It's much more compact. So the in-office one, I mean, they'll both get you great results. I think that you'll see faster results with the in-office one though.
Yes. Yes. The one in office is the most intense, and that's why it's like a machine. Yeah. If we could send it home with you for rental, we would, but you'd be putting down a deposit. Will it work on older women? Yes.
Absolutely. That's the nice thing too about this, as opposed to like PRF. If you think about like PRF treatments, you're using your own product from your plasma or fibrin. So if you're, 65 years old, your fibrin is also 65 years old. So that product that you're putting in the scalp may not be quite as effective as say, you're in your 20s or 30s, as where this is, it's more effective and you're not having to worry about the age of your product.
Right.
I guess.
More saturated, effective.
Mm-hmm.
It could be, or is likely more effective than your own. Can you use PRF though in conjunction with GetHairMD?
Absolutely. Yeah. It's great to use in conjunction with each other. Also, our NeoGraft hair transplant, great to use in conjunction with that too.
Yep. How much how much is the consultation?
Complimentary.
Yes, they are. Yes. For GetHairMD, yes, the consultation is complimentary, and you can call to book that or see next available appointments and book that online. Same scenario with the PRF treatments for a consultation. That's actually a 10-minute consultation over the phone with the providers that do it, just to kind of determine if you're a candidate, and then they schedule an appointment for you to come in for a first treatment. The BHRT consultations, that includes 2 appointments and lab panel work that's done with our nurse practitioner. And that's $225, and that can be applied towards your treatment if you do want to move forward. But a lot of people just like come in and do the blood panel review and consultation with Michaela just to get like a functional viewpoint of your labs, and she can make lifestyle recommendations, supplement recommendations. Like, it's way more functionally mindful, which is what our guests want beyond just like a routine blood panel review from your primary care, and it all comes back within range, but the levels could be like a higher range or lower range, but you're not going to get like kind of that feedback and review like you are here. Was there an older age where you'd say this would no longer work?
No, I mean, I've seen before and after photos of 80-year-olds doing these treatments and with great results. So as long as there is a follicle to stimulate, we can work with it.
You'd be eligible.
Mm-hmm.
Can you do a consult if the person has hair extensions? Good question.
That is a good question. I suppose it depends on the type of extension. So for the hair analysis, I need to like make a part in the hair and take a picture with the device. So I guess as long as the extension is kind of grown out a little bit, it would probably be fine to do.
Yeah, move it around.
Mm-hmm.
Ideally, if you're not having them in, just so you could like see fully like what's it like without, but you could definitely just move it, and you're still scanning the scalp where there's not an extension. No, the at-home red light is not technically the same strength as the in-office scenario, but again, both options are like will have a result, like are good. But again, the in-office machine is just more intense.
Yeah, it's more potent.
Yes. Do you see results when someone is on weight loss drugs and losing hair? So can you be on tirzepatide and?
Yes. Yep. So that is a side effect of tirzepatide or other GLP-1 medications, or just weight loss in general. If a patient loses, a lot of weight in a short period of time, you can send your hair into like a little bit of a shock, which is called telogen effluvium, where your hair just kind of is not doing that growth phase like it should. And so this is a great option to help someone in that scenario.
Nice. I'm going to do 2 more questions because we're 1 minute away from 12:30, and I did say I would wrap it. And there's a lot more questions in the question box, which we'll respond back to. So stay till the end so that you're eligible for our giveaways. And then if you guys are interested in booking a consultation, we can help you in the right direction. More than likely, you're going to want to do the GetHairMD consultation because Stacy can advise on the other 2 options as well. And then anyone who does book a consultation between now and May 16th is eligible for 10% off their hair loss treatment if they book the consultation and complete it between now and May 16th. So let's do 2 more. Does insurance cover the topical prescription?
It does not. No, it comes from a compounding pharmacy, and we don't take any form of insurance here.
And it's potential like you would get coverage, but you're going to have to like submit your own receipt. And like if I have like the receipt, I could like try and like say, hey, I paid for this and submit it to my carrier, but
you could try.
We don't bill the insurance.
You could use your
Yes.
HSA potentially.
Yes, but
Yeah.
a lot of people, there's another question here. Can you use FSA, HSA? Yes, we accept those, and a lot of people use them. All right. All right. So again, you're going to get a text prompt too if you're interested in scheduling a consultation. Text back hair if you're interested, and we'll reach out to you. And then, Stacy, final thoughts.
Great options for hair thinning and loss here. Different modalities that fit into lifestyle. If you're here close, the in-office laser is great. If you're not close, the at-home red laser is great. The prescription topical is fantastic. So lots of different options for different lifestyles.
All right. Awesome stuff. All right. Well, thanks, guys. We'll respond back to these text chats, and thanks for attending, and look out for an email from us later on more information and our giveaway winner. Bye.
Thanks, guys.
Thanks.